Good evening, everybody. I'm here with you live from my apartment in Brooklyn, and I have not chosen this manner of being with you tonight, but this is what we have right now here in 2020. For those of you, our sponsors and supporters who are at our virtual receptions before the program, please accept my apologies. We had some technological glitches. It did not work out the way we planned. And that is the theme for this year, period, right? I am looking at you on my laptop tonight. I wish I was with you in person. I wish I was hugging you. I wish I was asking you about how you're doing. And instead we have this. I have my laptop propped up on my kid's desk chair on top of a dictionary. And here's where I'm coming to you from tonight. I'm not going to talk about the E word tonight. We do not yet know what is going to happen there. I'm going to ask you all to join me in just putting it down for a minute. I'm going to take you on a journey, if I may, a little bit over this last year and talk about some of the hard times and some of the high points of the year. We can't talk about this year without talking about our losses. And so if everyone could join me from wherever you are tonight, right now, in taking a moment of silence to those we've lost this year, lost to the pandemic of COVID, lost to the pandemic of state violence against people of color, against people of trans experience, lost to violence at large. Take a moment with me now, if you would. Thank you. These days we begin every all-staff meeting at Callen-Lorde that way. And I think we can't move forward unless we honor folks who've been with us, are with us in a different place now, and who will keep on with their legacies as we are still here to fight. At the beginning of the coronavirus pandemic, Callen-Lorde jumped in right away. We started doing novel coronavirus testing on March 10th, before quarantine was declared in New York State. We did that until we were told not to, because the tests in short supply then were being reserved for use in hospitals. We pivoted from seeing our patients mostly in person, almost exclusively in person, to seeing our patients primarily virtually. We stayed open, though, the whole time. We kept our Manhattan site open for limited in-person visits for folks who could not be seen any other way because we needed to lay hands on them. And we set up our technology systems as quickly as possible. It was inelegant, but as we always do, we made it work. In those first weeks of the pandemic, we knew that our charge was to do what we always do, provide comprehensive primary care that keeps people healthy or as healthy as possible in the community, out of hospital beds and out of emergency rooms. And that is what we do best. And so that's what we decided to focus on. We wanted to do, though, something more. We wanted to be part of the overall public health response to the crisis. What should have been happening is a coordinated national response to this epidemic. And as we all well know, that is not what happened. And so we, as individual states, individual localities, individual organizations, individual people, had to make our own decisions that should not have been made that way. Callen-Lorde decided that the best way for us to help was to jump in and provide care in 2 different hotels where folks were being housed who otherwise would have been in sort of congregate living situations, either in city shelters or at shelters like the Ally Fournet Center, our partners who serve LGBTQ homeless youth. And we staffed those shelters. They were medical respite places. They were field hospitals. It's hard to say what to call them. Folks were coming to us in the hotels right out of hospitals. They should have been in inpatient beds a lot of the time, coming with nothing but the clothes on their backs, often not with medications for chronic diseases, not with food, not with phones, really with nothing. And our staff stepped in to provide 24/7 care, including some end-of-life care there, and did unspeakably heroic things, getting everything from folks' medical care taken care of, to getting clothes to people, to getting food for people, to getting basic toiletries for people. And our staff should not have had to be heroes. This should not have had to be an army of individual heroes responding to this pandemic. But that's the place we were in, and we made it work. As we were doing that, we were also working hard to get our brand new Brooklyn site open, as Peppermint mentioned. As those of you who've been to this ceremony before know, we have been dreaming of and planning for, envisioning a health center in Brooklyn where so many of our patients who see us in Manhattan and the Bronx reside. And it's the culmination of a decade-long dream that we were able to open that site on May 14th of this year, right in the midst of the pandemic. And that, again, is a tribute to our incredible staff and the incredible vision of our board of directors, who decided that we were going to do this and who made it happen. And so now, today, we are serving folks in 3 locations, in 3 boroughs in New York City: Manhattan, the Bronx, and Brooklyn. And our Brooklyn site has already seen hundreds and hundreds of patients. And you'll see some images from that site a little bit later this evening. There's something else we did during the pandemic so far, and that is that we sued the Federal Department of Health and Human Services. We are a co-plaintiff in a case to try to stop the incredibly egregious and harmful rollback of the anti-discrimination protections put in place by Section 1557 of the Affordable Care Act. And we're doing that in conjunction with partners, as so much of the work we do is done in partnership. Transgender Law Center, Transgender Legal Defense and Education Fund, among others. And that is another way we have responded to this pandemic, by continuing to fight for what we believe in and continuing to envision the world in which we want to live. Progress and social justice are not linear. And so I ask you tonight to join me in continuing to form collective vision about how we will end systemic racism and transphobia and homophobia and all the other oppressions that we live with every day. And so often, our communities have to fight for crumbs and Band-Aids rather than fight for the foundational change we want to see. And as a federally qualified health center that lives squarely within this country's governmental infrastructure, right, but has a grassroots and social justice heart, we find ways to shapeshift and maneuver the way our communities have done for so many years, no matter what situation we're in. And we will continue to do that. What we should be fighting for is universal healthcare access, is guaranteed living wages for everybody, is decriminalization of our communities. Those are the things that we want and need. All of you tonight, in your sponsorship, in your support, in your friendship, and you're trusting us with your healthcare are part of that vision. And I am so glad to be here with you with my little desk chair and my dictionary in my apartment. And I can't wait to see you in person. So stay tuned with us tonight. Keep in mind that lines are not the way to think about it. Again, I'll say it again, progress is not linear. Think about the concentric circles that happen when you toss pebbles into a pond, and keep tossing those pebbles, whatever your contributions look like. I love you. Stay strong, and I'll see you soon.